Stan Gibilisco here. Just a little commentary. I just noticed I've been having some edema trouble in my lower legs and feet. Something I've really never had before. I got it very badly when I was in the hospital, and I attributed it to a medication that they were giving it to me for constipation, supposedly. And it was one of these highfalutin drugs, you know, not just your ordinary old milk of magnesia or anything. It had to be something really highfalutin, and it highfalutined me right into a 20-pound weight gain in 3 days. I stopped it, and that went away. I'm getting it back again a little bit, and I've been noticing that a lot of common medications will cause this lower leg and foot swelling, and it can be pretty scary because it can also be a sign of other things like congestive heart failure or kidney failure. In this case, in order to relieve muscle cramps, I've been taking relatively large doses of ibuprofen, which interestingly enough has a lot of effects that I've noticed, just suspected. So here's the moral of this story, if there is one. Well, there certainly is. There's a lesson here. A lot of the drugs that we take actually make us sicker, in my opinion, than make us better. They may improve certain problems and then cause 3 or 4 others, and the net result is that you're sicker. I sometimes get a little cynical about that. I really don't want to go there. But sometimes I really wonder if some of these drug pushers, these legal drug pushers, want to keep us sick so they can keep pushing more and more drugs on us. You take a drug, and that drug gives you a side effect that you don't like, so you take another drug for that side effect. And then maybe there are 2 or 3 side effects, so you have to take 2 or 3 drugs to deal with those side effects. And before you know it, you're flat on your back in the emergency room with something like kidney failure or liver failure. I just am beginning to wonder whether the heavy-handed pharmacological approach to the problem of disease in the United States that has evolved over the past few years might not be getting a little out of hand. And whether, a lot of times, as I have noticed, not all the time, of course, but a lot of times, things will just heal themselves if you give them time. If you try to hurry it up with drugs, you may be getting yourself into more trouble than you're bargaining for. Of course, there are drugs that are absolutely essential. One of those happened to be an antibiotic in 1994 when I neglected to take it until my pneumonia was so severe that I was in the hospital. I thought it was the flu, and I thought we're overusing these drugs. Why use this one when I don't need it? Well, that was the one time I needed it. So I don't want to make that a blanket statement, but I think in a lot of cases we really need to watch those pills that we stick in our face. Stan Gibilisco signing off. Until I get addicted to the next drug. So long.